Hello, everybody. My name is Ebony. I'm your Sunset Doula, and today I'm going to tell you everything that you need to know about hospice. Hospice care is not a place, but a service. It can be provided in-home, in a hospital, or in a facility. It is specialty care that is person-centered and focused, stressing coordination of care, clarification of goals, and communication. It involves a team of professionals who address the physical, emotional, and spiritual needs of the patient. It is care that focuses on the quality of life of the patient and caregivers who are experiencing a life-limiting or terminal illness. It provides compassionate care in the last phases of an incurable disease so that people can live as comfortably and as fully as possible. Hospice care is a Medicare benefit, meaning all Medicare enrollees have a right to this benefit. It's covered by most private insurances at varying levels and by Medicaid in most states. Hospice care is for people who have a life expectancy of 6 months or less if the disease that they have continues on its normal course. Hospice care offers 4 levels of care, depending on the patient's condition and preferences. The first is routine home care, where someone will come out a certain number of hours or days every week to provide hospice care. The second is continuous home care, which happens less frequently and requires you to pay the majority of that out of pocket. If you need 24/7 around-the-clock care, then you need the third option, which is a general inpatient hospice care. This will be provided in a hospital or a hospice specialized facility. And the fourth level of care that hospice provides is respite care. When taking care of someone who is dying at home, especially someone in your family, someone that you love, it's very emotionally heavy and it can be physically taxing as well. Everyone needs breaks, not just in hospice care. Round the clock, family caregivers all need respite care. You can receive hospice care for 2 90-day benefit periods. After that, you get an unlimited number of 60-day benefit periods, meaning you'll have to recertify at the end of each benefit period. So the hospice medical director or another hospice doctor will have to assess you and determine that you're still terminally ill. If you're not happy with the hospice provider that you have the right to change it one time every benefit period. Medicare only covers hospice care if the provider is Medicare approved. So you need to find that out ahead of time. In order to find out if the provider is Medicare approved, ask your doctor or the hospice provider themselves. You can also find out from your state hospice organization or your state health department. If you're in a Medicare Advantage program, like an HMO or PPO, and you want to start hospice care, ask your plan to help you find a provider in the area. If you qualify for hospice, you, your family, and your hospice team will create a specific plan for you. They're going to talk to you about your wants, your needs, what you want your life to look like. They're going to assess whether you need help bathing, eating, dressing. Do we need to help with dressing changes? Do we need to help with medications? How often do we need to come out to the home? Or what services do we need to provide in the facility? They're going to create a plan specific to you and your needs. Hospice is a wonderful program. I was a hospice nurse for several years. That's what started me on this journey. Being a hospice nurse is what led me to where I am now, a certified end-of-life doula, teaching people about death and speaking to anyone who will listen to me. My heart breaks for people who have had negative experiences with hospice, because when it's done right, it provides so much value to people and their families. It's underutilized. And in most cases, people go to hospice later than they should. Hospice is all about comfort, comfort for the patient, comfort for the family. It relieves a lot of stress from the family so that you can focus on being present, so that you can start the grieving process, so that you can focus on quality of life and really appreciating the opportunity to say goodbye, because not everybody gets it. It also really alleviates stress for the family when a patient is actively dying, when the body is shutting down. Most people aren't familiar with the signs. They don't know what to do when they start to see or hear some of these changes. There are 3 medications that are commonly used when a person is actively dying, which means their body is actively shutting down. The first is morphine for pain, works better than anything else. The second is Ativan or lorazepam, which is an anti-anxiety medication that is also really good for respirations. When breathing becomes labored or difficult, it helps with that. And the third is atropine drops, levsin, or hyoscyamine. All of these medications dry up secretions. So when a body is actively dying, our lungs start to fill up with fluid. Most people have heard of a term called a death rattle, which describes the really uncomfortable sound and feeling of the lungs filling up. It's also a signal that the end is approaching. An educated and experienced hospice nurse is going to be able to educate you on what you're going to see moving forward. They're going to be able to anticipate some of your needs and create an easier process, a more peaceful transition. Hospice care is all about comfort. It's all about peace. It's a beautiful program. I can't say enough about it. I really hope that more people have positive experiences with it so that people start using hospice care sooner and more frequently. To reiterate what we discussed, some key main points that I really want you to hold on to. Hospice care is not a replacement for nursing home care. It's not designed to provide 24/7 care. If you want that, you got to pay out of pocket or go to a hospice facility. Hospice care is not focused on curative treatments or any medical interventions that are designed to prolong life. Hospice care is about choosing to focus on comfort and quality of life, not quantity. And the third and probably most important thing that I want to make sure you feel is that hospice care does not hasten death. I've seen on several occasions, not often, but it does happen, that someone would come into the hospice house that I was working at and they would get better. They would get better because we were feeding them really good food. We were providing excellent care. They relaxed because they weren't fighting anymore, so their bodies started to heal. You can graduate off of hospice. It doesn't happen often, but it does happen occasionally. Hospice is not a killer. It does not hasten death. It's all about support, education, resources, having more beautiful, more peaceful sunsets when we reach the end of our lives. If you want a one-on-one consultation with me, you can go to my link tree and set up one there. And while you're there, sign up for the My Sunset Times newsletter. If you made it this far, give me the thumbs up and subscribe to my YouTube channel. I know talking about death can be really hard and uncomfortable. So I want you to check out this video I did on the 3 reasons we have to talk about death. I'm sending you so much love and wishing you so much joy on your journey in your sunset stage. Until next time, peace.